Good morning, everyone. I hope everyone had a wonderful June. I know we are all really super busy with graduations, weddings, showers, everything. It's just a really busy month. School's wrapping up, kids are out. But I'm here to talk about a really important issue in gerontology and geriatrics, and that is the urinary tract infection in older adults, older women and older men, how important it is to monitor them. And I realize with normal aging, there probably isn't such a need. And you could, easily, if your older adult parent is going to the doctors quite often, a couple times a year, and they're just checking their urine routinely, there's probably no problem. However, if you have an older parent who is susceptible for many, many risk factors, or they have cognitive impairment and they can't explain their symptoms well, then we have to be an advocate. And being an advocate is hard, especially when it comes to something personal like urine. And I'm not a urologist, however, I do have a lot of experience with urinary tract infections, unfortunately, working in the field all these years. So, and as a gerontologist, I want to explain just my biggest concern with UTIs in older adults is they go undetected. And because they are one of the #1 reasons why seniors, especially in assisted livings or living alone at home or with a caregiver, go to the ER. And going to the ER is always difficult on someone with cognitive impairment or without. It doesn't matter, it's always hard to go to the ER. We all know that. And it's no place for someone with dementia. So in regard to that, I want to go over some tips that I've used over the years that have really, really worked. And I just give so much appreciation and kudos to Dr. Rod Schenkel, to so many people who really, Dr. Amy Pierce, just some wonderful neurologists who really have picked up on the fact that urinary tract infection can cause abnormal psychosis, delirium, and issues with older adults with memory loss, and they can rapidly decline and can be that cause. And of course, that is a reversible cause. We don't want it to ever become irreversible, but with the help of urology and of course gerontologists and geriatricians, we can all make this a better place for our older adults to not be in pain and not suffer. So here at Vista Gardens, we really, really try to be preventative. And you can't prevent everything, but you can do your best to be an advocate. And by being an advocate, we do ask our families in our admission agreement, and all of our admission agreement is on DocuSign. And DocuSign does help in so many ways just because the family or the advocate has time to review the admission agreement. This is paper. We don't like paper, because if you're getting it by email and you're clicking and signing, you have plenty of time. You're never rushed. And sometimes some facilities and some professionals are rushed, and explaining every paragraph is difficult. But if you have DocuSign, you can literally read it and then, of course, forward email questions, and you don't have to sign it. So in this case, we do want to be transparent, and we tell all our families on our tours we have a UTI monitoring program. What that means is we have a urinary dipstick consent to dip urine once a month or as needed. So if there are other symptoms, and what are the symptoms? We all kind of know, especially if you have someone in your family but who has Alzheimer's, you know the odor changes, lack of appetite, up at night more confused, more disoriented, more agitated, urinating more often, but hard to tell sometimes, right? Because difficult if they're incontinent or not. And then, of course, we do have that strong odor smell that's much different smelling than a normal urine, and color change in the urine. So if you're the caregiver or your caregiver's reporting that, blood, anything like that, anything cloudiness, So how are some ways? Of course, we're going to ask the doctor for an order to dip the urine, and then we're going to call the physician, and a nurse, a med tech can dip the urine. You can dip your parents' urine at home. You can dip your parents' urine wherever they are. And how you do that is you buy dipsticks. This is a hospital-grade dipstick bottle. It's always great to wear gloves when you dip urine. When you're dipping urine, you should use a sterile cup for sure, because you want to make sure as you're putting on your gloves, you're using a sterile cup. You're probably going to use a sterile bag. And then if you can't catch urine and you can just get your older adult parent on the toilet, use a hat. A hat is great in that it's going to catch it easier and you're going to be standing there with your hand. So you can pour it into your cup, seal it, and then hopefully when you're dipping, you're going to read the instructions, which really say to really dip this in the urine for at least 15 seconds because you don't know if you got the urine on there or not. So dip it in there, 15 seconds, look at it, and then compare it to what is normal and what's abnormal, and make sure you lined it up correctly. Then make a phone call to the doctor. Mom's urine's clear on our dip, or mom's urine wasn't clear, and here's what I'm reading. So when you do that, the doctor then has the choice, if there are no symptoms and your mom and dad are just perfectly fine, which we see a lot. You know, we do dip urine here once a month, so we get quite a few positives with no symptoms. Most likely the urologist or the doctor is going to say, well, let's not treat it, which I totally understand. However, if there's a change in behavior, a change in eating, a change in agitation, depression, whatever the change is, then of course they want to do further tests, maybe even a culture, and getting the nurse to do a real clean catch, which is better. You know, you never know if you're gonna have a false positive or false negative. A lot of times you get a false negative and they still have symptoms, so then the physician will ask for a UA clean catch and send it off to the culture and sensitivity. And that's really critical. However, we don't want our seniors to suffer. And if your loved one really is having these chronic UTIs, you need to go to a urologist. And a specialist really is helpful. They're going to go over prophylactic antibiotics. Is that a good idea or not? Have they had a catheter recently? Catheter UTIs are very, very, critical to treat and detect right away, because there could be MRSA or some crazy thing on that from that catheter. And catheters, indwelling or short-term catheters, are the cause of urinary tract infections. Your risk factor goes way up if you read some of the urology journals. Another risk factor is dehydration. Your older adult not drinking enough. In younger women, it's being unmarried. Probably not so much with older women, but there's other reasons. It could be anatomy. It could be just a whole bunch of reasons. But whatever it is, in older adults with cognitive impairment, they definitely do have different symptoms than a younger person. So when you go to the ER and they say, hey, your parent's fine, there's no issue, I don't know why you want a urine analysis, you say, you know, I'd really like it just in case, because they can't report symptoms correctly. And the symptoms change with the confusion and the things such as that we talked about before. So I hope this is helpful. If you ever want to buy any of these supplies, they aren't just for assisted livings. You can buy urinary dipsticks online. You can buy them through McKesson. You can buy them through any medical vendor. You can buy them through a brief company that sells briefs, older adult briefs. You can buy these from anywhere, even a medical pharmacy that you have in your neighborhood. These are at a medical pharmacy. So really everything is at your fingertips. I just really encourage you to be an advocate and to try your best to catch things early on and not wait till sepsis sets in or hospitalization. I hope everyone has a wonderful day and a happy June.